Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. This is where we talk about musculoskeletal pain, joint pain, back pain, neck pain, etc. And we are right now talking with Jerry in Camarillo.
Hey, Jerry, Dr. Darrow here. Thanks so much for calling in. And from what you said before, you had a meniscal repair of your knee about 6 years ago, and it did some good, but it's still painful. Is it getting worse now, or is it still post-surgical pain level?
It pretty much stays the same. I just have to be cautious of what I do with it.
Okay. Yeah.
Extra weight.
What kind of activities do you do? Do you do sports?
Well, mostly just walking. I'll be 81 in a couple months here.
Whoa, you sound young.
Well, thank you. I'm completely out of quarters. But I should be a lot more active, but I'm a little reluctant to stress that knee and make it worse than it is.
Yeah, I don't blame you. So I was talking before the break a little bit about my knee, and I've used stem cells and platelets to heal my knee, and I'm good to go. It was so painful I could do no sports at all, which for me would, it really depresses me not to be able to work out, run, play golf, and things like that. So I had a period where I was absolutely miserable, and then I injected it, and I actually, believe it or not, when it got so bad, I couldn't walk. And I drove down from the golf course where I was when it finally stopped working, let's say. It was just so painful. I limped off the golf course, and I drove down to my office, and I took out the ultrasound, which I can look inside the knee or any other part of the body with, and I saw a giant effusion. That's fluid in there. And I numbed it up, and I took out 35 cc's of hyaluronic acid and injected platelets and stem cells right then. And I repeated that 4 times that week, and my knee is good. It's really good. We don't generally inject people that frequently unless they're coming from out of town. Some people fly in from Europe or come from far away, and they'll stay in LA with us, and then we will do sequential injections quickly. But the typical is about once every couple of weeks if they need a repeat. And I did check my knee a couple of days ago. I was injecting someone else's knee, and I thought, hey, I'll just take a peek at mine and see how it's doing. And it was all pretty much dried out inside. The hyaluronic acid was gone. And I'm just very grateful that I do, a type of medicine that I can use on myself when I injure myself. And I don't have any doubts about it. Because of the way I work out, I will injure myself again. And different body parts pop up all the time. And when I fix one, I'm like, hey, I'm all done, I'm good, and then I'll hurt something else. So I would love to see you, and take a look with the ultrasound and see what that meniscus looks like, and see if we can help you heal it up. There's no reason you have to have pain anymore, and as far as I'm concerned, there's no reason you have to have another surgery.
I would not like to have another surgery, no. You mentioned that you, on yourself, use a mix of the platelets and as well as the bone marrow. Is that common, or is it case by case, or how does that seem to fit?
That's a case-by-case decision on what the patient wants to do with my advice.
Well, that's very encouraging. I will be calling your office to set up an appointment.
Thank you.
And
the phone number to the office for everybody is the phone number to the office for everybody listening is 800-300-9300. And if you want to send me an email, you can go to the website, which is www.lastemcells.com. That's www.lastemcells.com. There's a spot on every page where you can email me. I get back to every single person, and I would love to hear from you. I'd love to hear from you now also. We've got time left on the show. I'd love to talk to you personally about your own issues, about your friends or family, and the phone number to our studio right now where we're live and local is 866-870-5752. I'll repeat it for you to call me right now, 866-870-5752. And Jerry, I want to thank you for calling up, and good luck with your knee healing up. You deserve to be pain-free.
Absolutely. Thank you, Jerry. Again, the number here at the station is 866-870-5752. That's 866-870-5752. Check out the website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site, as well as watch him performing the treatments on videos. Lots of research there, too. And remember, when you call today, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, chock full of research for those of you who like that and want to understand more about how this works. And also remember that we are here Saturdays at 10 a.m. and again at 1 p.m. And if you've been listening for a long time, you want to call the office and make an appointment, then that number is 800-300-9300. That's 800-300-9300. And
we give a free copy of a book.
And we sure do.
Give us a call.
866-870-5752 is our number right here at the station. And we're going to go to Steve in Carpinteria.
Steve, Dr. Marc Darrow, I understand your low back is bothering you and you may have nerve damage.
Issue with my lower back. What's that?
How long has your back bothered you?
Oh, 10 years. I've been told by, doctors to get, the back fused. I have a couple slip discs and herniated discs, and I just wouldn't go through with it because it takes, it takes so long to heal, and the percentage rate is 50% success rate. So I didn't think it was worth the risk. But the pain level's getting so bad that I quit skiing 4 years ago. I still golf, but my legs go numb for the first 3 holes, and then somehow I get through it. But what I'm trying to do is find out if your system would actually work against something like that with slip discs and, kind of herniated disc situation.
Well, I have to ask you some questions first to figure out some of that, and then I might have to actually touch your back to get a more conclusive idea. But the first question is, do you have pain in your low back?
Yes.
Okay. And second question is, do you have pain or numbness in your legs?
Yeah, it goes, my legs go completely numb to the point where I can't even feel my knees, and I kind of lose balance and can't, it gets really bad.
Okay. So I probably cannot help the numbness in your knees or legs. That does sound like it's a nerve issue. If it's in both legs, it could be some kind of a spinal stenosis, meaning the nerve roots are being squeezed. They could be squeezed by a herniated disc or by overgrowth of the bone, arthritis. How old are you, Steve?
60.
60, yeah. So that's a possibility. If it were just the back pain, I'd be more confident that I could help you, okay?
Right.
So I would have to examine you and see what's really going on.
Yeah, I'd be willing to do that. You know, at this point, you just do anything you can, right?
Well, be skeptical about surgery. Like you said, there's probably a 50-50 chance it'll make you feel better, and a 50-50 chance that it could make you worse. So,
exactly.
Unfortunately, I have a jaundiced eye about it because obviously the people that come to me have had failed surgeries, not good ones, or they wouldn't be coming to me. So I don't particularly like surgery, and as you may have heard before, I had a shoulder surgery done on my right shoulder when I was in medical school doing surgery by my boss, my professor, and it came out as a disaster. So I've always looked for things other than surgery. So I'd love to see you. The phone number to the office is 800-300-9300, and there are people by the phones you can call. If you want to look at me injecting backs, you can go to the website and see videos, and that's at www.lastemcells.com, www.lastemcells.com, and you can email me directly from that website also.
Okay, great.
But I think there's, and sometimes when we get rid of the back pain, inject the low back, the leg pain or numbness goes away by stabilizing the back. So I'd have to examine you. I don't work off of X-rays or MRIs. I work off of my examination. I like to have those images so it gives me an idea of what's going on, but I don't trust them. They show things that aren't real. They're overly sensitive.
Thank you, Steve. We appreciate your call. Our number is 866-870-5752 right here at the station, and you'll get Dr. Darrow's free book as well. That's 866-870-5752. And we're going to go to Dave in Camarillo.
Dave, I understand, this is Dr. Marc Darrow, I understand you have lumbar issues, lower back, and how long has that been bothering you for?
I guess we're on the same subject as the last guy. This has been going on for about 3 or 4 years.
Okay. And you've been to a doctor, yes or no?
Have I what?
Have you been to see a doctor already?
Oh yeah, I've had 2 surgeries. So, my first one, I had to have the first one because I had a big herniated, like a 9mm bulge, and it kept. I was a college softball coach, and so it would hit my nerve, and I'd be on the ground for at least a week. And so I had a microdiscectomy on my L4-5, and they took that out, and I haven't had that problem since. But I've had some leg issues. I understand you said there's not much about the numbness in the leg, but
not typically. If it's coming from a nerve that's being impinged, then often there's nothing I can do. But I have to tell you this. I have had endless numbers of patients come in saying they had a herniated disc with leg pain and back pain, and I've injected the low back and all their pain has gone away. So I've got to examine people. There's a lot of wrong diagnoses that are going on based on MRIs, and I don't trust MRIs. I've got to examine the patient with my hands and touch the area and see where the pain is coming from. There's one story of a couple that came in, and the woman had a fused SI joint. She went in for surgery and had it fused. And I touched the area where she was having pain, and she jumped and said, "That hurts." And I said, "Well, that fusion didn't do you any good." I said, "You need to do what I do for this, because it's not a surgical issue." And she said the surgeon told her that if she didn't get another surgery, she would be paralyzed. Well, I worked on her, one treatment. She came back 2 weeks later, and all of her pain was gone. And the funny part about it was, before the first treatment, I said, I don't think you need the surgery. I think I can get rid of all the pain. And she said, I don't care if you get rid of all the pain. I'm still going to have that surgery because the doctor told me I could be paralyzed. Her husband was sitting there rolling his eyes and said, honey, did you just hear what you said? If this doctor fixes the problem, you're still going to get a surgery? And she said, yeah. When she came back and was pain-free, I said, are you still getting the surgery? And she said, no way. So we have to be very careful. If you are a surgeon, listen to this, hear me out. If you are a surgeon, what do you do for a living?
Oh, absolutely. Have surgery.
I'm not saying it's good or bad, but you're slanted toward doing surgeries. And to be honest, when I have someone who has something that I think might need surgery or might be healed by using platelets or stem cells that I do, I still force them to go to a surgeon. I give them a name. I give them a phone number. I say, call them right now from the office, get an appointment, and get their point of view. But be careful, because unless they tell you that you have to do this, personally, I wouldn't do it.
Right.
I have cases on my body where my surgeon buddies, I have a lot of surgeon friends, where they've told me, Mark, you have to get a surgery. And I haven't done it. I've injected it and gotten better. So this is not a statement against surgeons. This is a statement that too many surgeries are being done because it's our culture. The new culture coming up is regenerative medicine using platelets and stem cells. But it's going to take a while.
And that's what I believe in that, I think, myself. Having had surgeries, I don't think that it's really... I jumped the gun on, I had some stenosis, but I wish I hadn't done that. I'm more concerned with the recent MRIs showing there's fluid in my facet joint in a couple of vertebrae, and I'm wondering if this could maybe help stabilize the L4-5 joint, because it's probably 70% pain, and the numbness in my leg is mild. It's not the problem. It's more of the pain in my lower back.
Well, if we can help the lower back, then often the leg issues go away. Not always.
Yeah. I just want to kind of see if I can do something to help with the pain just in my, my lower back, lumbar area.
Well, then I think this is something that could possibly work for you. I would have to touch the area and see if I can elicit the pain in the area I think it is. And you can watch videos on my website, www.lastemcells.com, lastemcells.com. And the videos will give you an idea of what I do and whether you think it's something you want to do.
Yeah, I do. I want to try this because I've tried pretty much everything that's out there. So, I think this could really help.
Well, God bless you, man. I appreciate your call, Dave, and I hope that you would make the trip over so I can let you know what I think is going on. I'm a little bit of a maverick in medicine, always have been, and now my work is becoming more mainstream. I've taught these techniques at UCLA for the last 20 years or so, and a lot of those people coming out of the residency program and a lot of the doctors at UCLA now are using these techniques. So I've had a good life of medicine. I'm very happy with the work I've done, and I train doctors from all over the world that fly in to learn how to do regenerative medicine. So I think I can help you. I won't know for sure ever. I can't guarantee anything in medicine to anybody, but there's a good chance based on what you're telling me that we can help you. So God bless you, and I hope to see you soon.
Thank you for your call, Dave. Our number is 866-870-5752, and we're going to Brett in Irvine.
Hey, Brett, which tendon bothers you? This is Dr. Marc Darrow, the call screeners, said you have a tendon problem.
Correct, since February. It's swollen. It's a little bit better than it was. I had the Dr. Soul's lifts in there that help rather than walking on a flat foot. Stretching helps, but the pain's still there.
Are you talking about your Achilles tendon?
Correct.
Okay. So, the one thing you can do with me if you want to start a dialogue is you can email me a photograph of the back of your Achilles. You lay face down, have someone take a picture of both Achilles together. And generally what happens if someone has a very severe case of Achilles tendonitis on one side, it'll thicken up and it'll be twice or three times the size of the other one that doesn't have pain. And I've had good luck in healing those. I've had some that are on one side as thick as a pinky, and on the other side are like two thumbs put together. And personally, as a doctor, I don't inject into the tendon. I inject underneath it and allow the platelets or stem cells to move into that tendon. I don't want the Achilles tendon to rupture from needle pokes. That has happened before. And I use very, very thin needles on that area. I use a 30-gauge needle, which is the smallest needle we can inject with. So we want to keep you safe. So I would have to see it. And did you happen to get an MRI to see if there was a tear in it?
I don't think there's a tear now. I've been to a couple specialists, and I can get an MRI, but I haven't. I have insurance.
Okay. It's a good idea, to be on the safe side. A lot of times new patients come in and they say, I heard you on the radio, you don't like MRIs. I do like MRIs. I do like anything I can get, but it's not the end all, and it's more of the examination that tells me what's going on. Usually with the Achilles tendon, I can feel a little knob, where it's inflamed. And if it's severe enough, I will get an MRI, see what's going on. It gives it doesn't really help me in my treatment, but it gives the patient some a benchmark of where they're going and how long it may take to heal and what the chance of rupture is.
Okay.
So, Brett, I think there's real good hope we can heal that up. I generally like to make orthotics for the person. It's a cast they step into, a foam cast, and then I send it out to a company that makes the inserts into the shoes, and it takes the pressure off of the instep and then can help with Achilles tendon and bunions and things like that. It's not mandatory, but it's helpful.
Okay.
Thank you for your call, Brett.
God bless you, Brett. I appreciate your